to episode 4 of Meet the Toberts. This is a podcast about thriving in and out of medicine, no matter where you are in your training or career. My name is Darren, and I am a sleep medicine physician and have been in medicine for 42 years, including learning.
I'm Sue Tobert. I'm a recently retired pediatric cardiologist, and similar timeline to Darren. We're husband and wife, and I guess that brings us to a combined experience of 80 years in medicine. And we're here to share some of the life experiences that we've had just maneuvering through challenging careers in a challenging field, right?
Mm-hmm. Yeah, so today's topic is family matters. And family does matter, so it's an important one. We're going to break it down into 3 parts. So this will be part 1, and just starting about thinking about having a family, some issues around planning for that, and actually getting started with having a family. So that means kids.
All right. So the beginning, I'm going to just take a 30,000 foot view here for a minute and share some sobering news on fertility and pregnancy among physicians. And you may be aware of some of this, but here are just some recent publication titles around the topic. A comparative analysis on fertility success among physician specialties, high infertility rates and pregnancy complications in female physicians indicates a need for culture change. Another title is Childbearing, Infertility, and Career Trajectories Among Women in Medicine. And a really, I think, sobering publication is entitled The Incidence of Infertility and Pregnancy Complications in U.S. Female Surgeons. So it's a tough topic to talk about, and certainly more and more is coming to light around the difficulties of and challenges of infertility, conceiving, even pregnancy loss, pregnancy complications in women who are in medicine, practicing physicians. Some of the research has suggested that if given a choice, female physicians might have attempted to conceive earlier in their careers, or even to consider cryopreservation during their careers, knowing if they knew that infertility was going to be an issue. So I think that we bring awareness to this. We are certainly not experts on the topic, except for our little piece of life experience that we'll share. And we just really want to be mindful about everyone who might have experienced some challenges in thinking about and planning for having kids, for having a family.
So today's focus will be based on our experience about thinking and starting a family, some of our thoughts, our decisions that we made, and our experiences along the way.
Yeah. And we just recognize that if this topic touches a little bit deeper in your heart, just have compassion for yourself and reach out. Connection is really important, so tap into your support resources. Mm-hmm. One of my favorite poems, or poets actually, Harry Baker, recently posted a poem called Trying. And if you're not familiar with his poetry, he just has a really profound view of life.
Is he a physician?
He's not. No, he's he lives in the UK. But what he shared in this poem, and we're going to give you a link to this poem entitled Trying, is not so much about, how to have a family or thinking about getting pregnant. Like, those are kind of just really maybe a little bit kind of harsh terms to describe this process. How he lands in his poem is really it's about those who are hoping to make a life. So this topic is so much deeper than just getting pregnant or infertility, right? It really gets down to the nitty-gritty of who we are as humans. When you think about this topic, we're thinking about and hoping about making a life. And so I just want to take a minute or so to share our personal experience with pregnancy loss, or I guess that's kind of what it was. when we were pregnant with our second child back in 2000, about 20 weeks into the pregnancy, I had concern that I didn't notice any fetal movement when I had noticed it a day or two prior, right? And sometimes first pregnancy, not so noticeable until later on in the pregnancy, but it was clear fetal movement that I noticed, and it wasn't present. We talked about it and we're like, well, we don't know what to make of it. But, being a physician and a cardiologist, I have an echo machine at my fingertips and I know how to do ultrasound, right? And so the morning after we had spoken about it, I went in and did an echo on myself, or did an ultrasound on my abdomen, and discovered that indeed there was the fetus and there was no heart movement. And I do fetal echo all the time, so this is not difficult to figure out. And so there I was, this highly trained fetal echocardiographer, pediatric cardiologist, lover of children, and I had just diagnosed myself with fetal demise. And just the overwhelming helplessness that occurred in that moment, not seeing any heartbeat or any fetal movement. And I knew Darren was busy that morning in the ICU. So the first person I reached out to was my OB, who's also a colleague and a friend. And I told her on the phone, I'm like, look, I just did an ultrasound on myself and there's no heartbeat. There's no fetal life. And she said, well, I can't believe this. That's crazy. Come on up to the clinic right now. And indeed, she confirmed it. It wasn't hard to confirm. And I remember a statement she said. She's like, I've never had anyone come in to share with me that they've already self-diagnosed that there was no fetal heartbeat. So unique experience for her immediately too. And then I reached out to you, and interestingly, the nurses answered his page and said he's busy placing a chest tube. So I couldn't even get to the most important person in my life at that moment in time to share the news. And it probably took an hour or two before you got there. And I'd been admitted, and we went through delivery, et cetera, over the next couple of days. And a lot of grief set in, and there was really limited privacy being
small hospital.
Yeah, being the only pediatric cardiologist in the hospital. I mean, so much for HIPAA. That went out the door. Pretty much everybody knew, including the med students. I remember that. And after, my health, everything went fine, that whole physical part of it. Thankfully, we had a week of vacation immediately at that time, and we headed off to be with family, which was really supportive. And I guess, that's kind of the story of it, but let me just go a little bit deeper. You don't know what you don't know. So that was probably the biggest degree of grief that I had ever experienced in my life to that point in time. How about you?
Yeah, I mean, it was, I think at that time, both your parents were still alive, and we hadn't really experienced loss as a couple before that. So it did kind of come out of left field and just hit hard.
Yeah. And like I said, you don't really know what you don't know. So we didn't really know who to reach out to except family support. We visited your folks. They had limited experience with this too, and were as supportive as they could be. And then, you know what, you come back after a week of vacation, and what happens? Work is piled up. You got tons of stuff to catch up on, and you just hit the ground running again. And unknown to me at that point in time, well, not only did I really not understand grief, but I had not had really, and maybe this is the same for both of us, time to mitigate it or even tend to it. And it became kind of complicated. And complicated grief is really when you enter into this prolonged grief state, usually associated with the death of a loved one. And literature does actually suggest that even miscarriage can be associated with prolonged grief. So tend yourself well and your grief well if this is something that you've experienced. Infertility can be associated with grief. And so I was told I had postpartum depression, taken SSRI. And in fact, years later, as I learned more about how I manage grief, I've come to different conclusions. And our society is kind of grief phobic. Like, even though we might deal with death and dying in medicine, right? It's just a challenge when it lands really front and center in your own lap. And so if this is something where maybe you've experienced miscarriage, stillbirth, pregnancy loss, infertility, loss of a child, 25% of parents experience loss of a child. Um, this is a unique collective that we're in, and it's okay to connect. The other thing I would say, just my personal experience too, is that sometimes unintentional hurtful comments will come your way, even though good intention may have been present. You can have another baby, you're still young. Oh, the baby wasn't even born yet. You didn't even, you didn't even know who they were, etc. And my response to that is people, again, in this grief phobic society, simply don't know how to handle situations like this. Their degree of feeling uncomfortable is crazy over the top, and they might even withdraw. We had a colleague who didn't connect with us for many, many months because they didn't know what to say. And so don't have high expectations, I guess is what I'd like to say there. Most people haven't dealt with that degree of grief.
Yeah.
So my compassion grew for others around this. And I guess share a little bit about being a spouse in this.
Yeah, well, this as a spouse, of course, I'd felt the baby move, was excited for our second child, but I think there's a different connection. So I experienced grief too, but I would say it wasn't as severe as yours.
Mm-hmm.
And I think that just makes sense for the time at which we lost the child. It was just, I hadn't had a chance to really bond with the child yet as much. So, yeah.
Yeah. So you're on different grief experiences and timelines. And I think trying to support one another in your needs in the moment as best you can is really important
Right.
and helpful.
Yeah.
Yeah.
I think the big thing was that we didn't realize that you needed more time than what was, traditional. Don't you have some stats about how quickly people return to work after a pregnancy loss? And, we were 20 weeks along, so halfway through a pregnancy, had to actually deliver the dead fetus. And, that involved being in the hospital, going through labor. They had induced labor to get the baby out. And so that was just an incredibly emotionally and physically traumatic process. So I think that there needs to be more understanding of that within medicine. And you've got to be prepared to support a colleague in that. And you've got to be prepared to demand time away, even if there's no vacation or stuff that you can use. You need to take personal leave, maybe not be paid for a while, just to be away for a while. And employers need to increase their understanding and accommodation for people who've experienced grief like that.
Yeah, it's really true. You have FMLA, right? Use your FMLA. I can't say more about that. And judgments are going to come at you. Why isn't she back at work? Why isn't she back on the call schedule, right? Those things all came my direction. And I just, bucked up and powered through. The one reference we're going to give you about female surgeons, the stat there is 75% of female surgeons took no time off of work after miscarriage, and nearly half took off a week or less after stillbirth. So why, right? For these reasons.
Yeah. So with pregnancy loss and loss of a child being experienced by 25% of couples, maybe we start to see why physicians are having higher levels of mental health issues overall. Maybe some of this is our very poor response to traumatic life events.
Right. And maybe as you're saying that, I'm thinking maybe all that response to trauma like that comes in part with our training, right? Your patient dies, you finish rounds.
Right.
Like within 30 minutes. Yeah. It's really hard, I think, in general. Now, as we're talking about this, right, we've had a quarter of a century to process that experience, and it still tugs at our heartstrings. And what comes out of that kind of grief experience can be a lot of learning and a lot of growth, self-awareness around how to do grief differently. I've done grief differently since that experience, and tapping into a lot of helpful resources has helped me with that along the way. And
Mm-hmm.
now we've lost parents and other family members, and you got to learn about yourself. How do you tend your own grief
Mm-hmm.
is really important. So advice in the literature says surgical practices and training programs should support bereavement after pregnancy loss by assuring an empathetic environment and appropriate time off to work through the grief process and seek support.
Mm-hmm.
Well, that's obviously a great bit of advice or recommendation. And is it happening across the country? Not at all.
Mm-hmm.
And your own area is best and what to experience. And what I would say, my piece of advice is take time to observe how you're doing, how you're feeling, push hard for what you need, ask for it, tap into FMLA.
Mm-hmm.
This is including around fertility, taking time off after a failed IVF. I mean, these are big things in life,
Mm-hmm.
as big things in life because you're trying to make a life, right?
Mm-hmm.
Yeah. What would
Mm-hmm.
be your takeaway on that?
Yeah, I think that's the bottom line, is just that as physicians, we just have to give ourselves more time to grieve when life happens to us too. And again, physicians are humans. We're not exempt from the emotions and trauma that happens to other people. So we just can't pretend like we are. And I think that's our call, would just be to recognize that you are human. And that comes through in a lot of our episodes, I think.
So, yeah.
So, okay, let's move on from that topic to talk a little bit about life balance with young kids. How did that go for us?
Yeah. So we had a daughter already. This was our second child that we lost. So we had a daughter. So we're in the midst of still dealing with a 3-year-old and all of that kind of stuff. And I even think back to when she was first born, adjusting to parenthood after you're in the midst of a busy medical career is incredibly challenging. I mean, it was like a 180-degree turn for me as a mom,
Mm-hmm.
even thinking about getting back to work. I have always since then worked part-time, a 0.8 FTE. But here you are, we're a physician couple living a very independent lifestyle, doing things at the drop of the hat on your weekends off, when you do have weekends off. And then this little person comes along, and how you manage your energy and take care of yourself and restructure the schedule. Kids get sick, right? All that kind of stuff is just crazy. And for me, one of the things that started to creep in early as a mom was just the guilt of being a parent, not being able to be there all the time and 100% support my kiddos. And we had a community, right? We already talked about this. We had a nanny, we had used daycare.
Mm-hmm.
Important milestones sometimes happen. I remember with our one daughter, she walked on a day that we weren't around.
Yeah.
We got to see it that evening, but we missed that first step. Yet society tells us that first step is really important to see, right? So
sure.
I don't know. It's just the expectations, I think, that are out there that we put on ourselves.
Mm-hmm.
I don't know. What would you say about parent guilt?
Well, sure. I mean, at the time when we had young kids, I was working anywhere from, 60 to 90 hours a week, and including calls. So some of that was time at home too, but not much. And, when you're on call, even if the pager doesn't go off, you're not really present. Your thoughts are at the hospital and, at the patients that you're responsible for and what's happening with them. And so, yeah, I do have some guilt about just being away at those critical times of our young kids' lives. So I think as you're trying to assuage your parent guilt, you just got to look at your life and say, look, what's realistic to expect from one person? You may not be able to raise your kids exactly the way that you would love to, being with them every minute for the first 3 years. It's just not possible with a physician career. So I think you've got to set realistic expectations of what you can possibly achieve. It does not help to compare yourself with other parents who seem to be doing it better. You're just going to, build up your own guilt with that. I think reflecting and learning about how maybe we could have done things differently is helpful to at least advise future physicians
Right.
like yourselves. Think about gathering your team of support around you, having people to help with the chores of child raising, so that the time you do spend with your kids is higher quality and less administrative, sort of, so to speak. So yeah, I think those are some things that we can do to help. Is and honestly, yeah, we're going to talk about it a little later, but go to part-time. Go to part-time earlier in your career. Cut back a little bit on the income in favor of more family time would be a strong piece of advice. And I didn't do that until just a few years ago. I wish I'd done it 10 to 15 years earlier.
Yeah. Yeah. But one of our policies as a couple is no regrets, really.
Right.
I mean, you
Yeah,
can't
you
just go
can't.
back and beat yourself up.
Right.
Right.
You can't go back. So
No benefit to rumination and sabotaging yourself based on what your past experiences were. And actually, that way, we can't even call them mistakes. It's just how it unfolded,
yep.
right?
Mhm. Yeah, we lived in the moment and
Right.
did our best at the time. So yeah.
Right.
Mhm.
And learned along the way a lot.
Yeah.
Yes. So we've hinted at a few things here today. Uh, the beginning, right? This is part one of Family Matters. And we always like to bring a little bit in about kind of the budgeting expense part of it too.
Mhm.
And so I'm going to turn that over to you. Like all this thinking about this stuff, I'm just thinking about dear friends of ours who went through IVF twice. They have two wonderful children.
Mhm.
Maybe they went through it more than that. I mean, just the expense around all of this stuff is crazy,
Right.
including once the kids arrive.
Right. So, from a financial standpoint, obviously, I think um, hard to say anything about IVF because we never experienced that from a financial standpoint. Honestly, at that stage in life, when you feel called to have children, it's not really about the money at all. And so I don't think we ever talked about it really in those terms, like, oh, what's this going to cost us? Obviously, there's a lot of articles out there and a lot of estimates as to what it actually costs to raise a child over the course of 18 years until you can kind of launch them and get them off the family budget, shall we say.
Yeah.
And so you can look those up and find out. I think your budget adjusts, right? So while you're spending more on daycare, you're spending a lot less on travel. While you're spending more on baby food, you're spending a lot less on dining out. It's just these things evolve as part of your family and your budget. So I would say as long as you've got a solid job as a physician, financially you'll be able to have kids. It's not something to worry about too much.
Mhm.
You'll still be able to save for retirement. You'll still be able to pay off your student loans and so on. IVF is a whole nother matter because it's like what, $20,000 to $30,000 a pop.
Know. Yeah.
And depending on your level of success with that, it may take multiple attempts, and so that is a very large financial investment. So I don't feel qualified to talk about that all that much. Just other than
planning ahead,
it's
right?
looking ahead, planning your budget, making sure that you're not going to, harm your retirement. That is very important to be able to get to a point where you're able to retire.
Mm-hmm.
So balancing these different priorities, I think, is part of the financial part of it.
Yeah, as you're sharing this, something popped to mind. So early in our training, so when we were residents, right, we're earning some wage, and we certainly could have had kids at that point in time if we were feeling called to. We weren't at that point yet. And what we did is we observed several of our friends during training who did have children. And what really shone out to us was the level of stress they were under, trying to manage life as a resident with sometimes limited ability to shift because you're covering other people. It's not like you have any independence around your schedule many times.
Right.
And one family had a child with some special needs that was even more stressful for them trying to fit that in. And so we said, okay, we're just going to focus on our career at this point in time and think about kids after we're done. Not that you can ever completely plan it, right?
Well, no, you can't control it because it's biology. But we made a conscious decision to wait until we were young attendings.
Yeah.
to start trying to have kids. And that means that we were married for how many years? 11 years before we had our first child. So, yeah, I mean, you can't, we know two doctor couples who had kids as residents, and their level of stress was just unbelievable. So, it looked really hard.
Yeah, that factored into our choice, right? I mean,
Sure
it's different
did.
for everybody. And, I think as you're sharing that, I'm thinking like we waited for 11 years. That made me fit into the category of advanced maternal age right there, right?
Mm-hmm.
That didn't affect our ability to get pregnant. But I mean, those things, your career does challenge you.
Yeah. So there's some tips to think about if you're planning to have kids, especially if you're looking to have kids in medical training. And White Coat Investor has a nice article on this that we will link in the show notes. So they suggest, number one, if it's at all possible, to plan your residency close to family, extended family that can maybe support you as a young couple with kids. Certainly if grandma's next door, that would help a ton. Consider very early on in your career taking less pay in exchange for more flexibility. Working part-time is okay. You'll still be earning a greater than average salary for your average American as a physician, and you will gain enormous flexibility for that. It's certainly very reasonable to not take on major financial commitments like a mortgage. And so to maintain your flexibility, your ability to move to different quarters as the family enlarges, renting for the first few years and keeping your physical expenses relatively low is reasonably helpful. And then obviously things like buying used rather than brand new everything, and taking advantage of all the social services that are available out there.
Yeah. May I just add a couple things to that?
Yeah.
So we didn't have the option of living close to family. We were 2,000 miles away. They were all in Canada. So we tapped into a lot of resources like the nanny daycare options. That contributed to a little parent guilt, right? So you're balancing that.
Mm-hmm.
I wanted to mention that when you work part-time, there are some challenges that might come up for you as a woman working part-time, or I guess as a man too, but more traditionally, it's the woman who works part-time, but is regarding career advancement, right? And boy, we've heard this lament many times that, okay, I'm going to work part-time when my kids are little and then try and advance my career. And sometimes that's just really hard to do. So there's choice there. You're always at choice. How am I going to do this? And how am I going to elevate my career, especially in academic medicine?
Right.
You mentioned buying used items. I borrowed maternity clothes from other residents and attendings who were more than happy to share. And so thinking early, right? We're about being proactive in this podcast. Get creative around that.
Mm-hmm.
Yeah, absolutely. So in conclusion, we touched on a couple bigger topics today. We could talk on this a lot longer, but as you're thinking about entering into making a life, starting a family, remember you're human first. So just be mindful of your needs and desires as you go along around fertility and childbearing, raising your family. Try to be proactive if you can, but it's ridiculously crazy because all of this is unpredictable. But continue to dream big. And I guess we'd say don't totally stop the rest of your life. It's hard, right? You get that positive pregnancy test and suddenly the next 9 months looks like, oh my gosh, what are we going to do? And everything's on hold. And sometimes life just happens, including hard stuff in life. And then the whole parent guilt piece, we might hint at that again, but don't let it overwhelm you. Yeah. Those are my kind of tips. What are your tips from today?
Yeah, I mean, you do what you can do, right? So the decision to have a child is never an intellectual decision. It's an emotional and a spiritual decision, and a decision that's almost more like a calling that you feel in your heart. I don't know how else to put that. So don't let the rest of society, what's going on in your life, work, commitments, busyness, don't let that make your decision as to whether or not to have kids. It's the greatest thing I've ever done as a man, is to have children. And so don't forget that. Don't discount having kids because there's no time for them. Don't discount having kids because there's no money for them. Life finds a way, and the fulfillment and enrichment that comes to your life through children is just incomparable. So that would be my upbeat kind of assessment of it. Go for it. Don't hold back, and definitely have kids.
Yeah. And I guess I just finish up for those who may be challenged with infertility or make the choice to not have children. Hey, we totally respect that too. We have many friends who have chosen that and walked that road, or have been given that journey, and that's for you to decide, not us. We've just shared our experience today. So thank you for entering into our circle of trust around family matters, part 1. Thinking about making a life, and we'll be back next week with next podcast, I guess, with part 2.
Yep.
Thanks.
Good. Bye, everybody.
Bye.